A webinar with slideshow. Speaker in top right corner. On-screen text. July 11, 2024.
Good afternoon. I'm Commander Anna Kahn, Associate Director for Communication in the Division of Environmental Health Science and Practice at the National Center for Environmental Health at the Centers for Disease Control and Prevention. I'd like to welcome you all to today's Environmental Health Nexus webinar titled Overview of Wildland Fire and Wildland Fire Smoke for Public Health Agencies. This is part one of a part two series. We invite you to join us next week for part two on July 18th from 2 to 3 p.m. Eastern Time, titled Wildland Fire Activities in State, Tribal, Local, and Territorial Public Health Agencies. Today's session will feature a presentation followed by a Q&A session with our panelists. Please note that all participants are in listen-only mode and closed captions are available for this webinar. Next slide, please. Today's Nexus webinar will be available to view on demand in a few days. You can find the video recording of today's webinar at CDC's Nexus webpage at cdc.gov/NCH/EHSP/EHNexus, or you can scan the QR code. Next slide, please.
Media Relations, media@cdc.gov. 404-639-3286.
You may submit questions at any time during today's presentation. To ask a question using Zoom, click on the Q&A button at the bottom of your screen, then type in your question in the Q&A box. Keep in mind that we often get more questions than we can answer in a live session. Next slide, please.
Disclaimer.
Please note that the findings and the conclusions in this report are those of the authors and don't necessarily represent the official position of CDC. Next slide, please.
Photo of Eric Svensson.
It is my honor to introduce Dr. Eric Svensson. Dr. Svensson serves as the Director of the Division of Environmental Health Science and Practice at CDC's National Center for Environmental Health. Dr. Svensson would like to provide some brief opening remarks before I introduce our panelists. Eric, the floor is yours.
Wonderful. Thank you so much, Anna. I'm so pleased that we're able to host this event today. Many of you still remember the events of last year with the wildland fires issues going on all across North America and the smoke issues across the U.S. We have fires going again this summer, and many jurisdictions have issues related to preparedness and resilience from fire, even if they don't have a fire in their area right now. Wildland fire is an issue of land management, of natural resource management, of public safety, firefighting, environmental regulation, and environmental protection. And most of all, for this audience, it's a public health issue. And so for the session today, we're bringing those perspectives to you all from our colleagues across government to be able to give you a little bit of a window into the work that they do and the agencies that they represent, and also different perspectives on this multidimensional problem. I'm looking forward to hearing from everyone and also hearing your questions and comments. So thank you for joining us, and we look forward to walking through this discussion together.
Photos of 5 presenters.
Thank you, Eric. Okay, now I would like to welcome our 5 subject matter experts who will be presenting for today's Nexus webinar. We are pleased to have with us Captain Antonio Neri, Chief Data Scientist at the National Center for Environmental Health at CDC's Division of Environmental Health Science and Practice. Pete Lom, leader of the interagency Wildland Fire Air Quality Response Program at the U.S. Department of Agriculture, Forest Service, Fire and Aviation Management. Brett Anderson, the National Air Resources Program Lead in the Division of Wildlife, Aquatics, and Environmental Protection at the Bureau of Land Management, Department of Interior. Jason Sachs, Senior Advisor for the Wildland Fire Science in the Integrated Climate Sciences Division at the Center for Public Health and Environmental Assessment, Office of Research and Development at the U.S. Environmental Protection Agency, and Sarah Cofield, Federation of American Scientists, Wildland Fire Smoke Solutions Impact Fellow in the Integrated Climate Sciences Division at the Center for Public Health and Environmental Assessment, Office of Research and Development at the U.S. Environmental Protection Agency. Thank you to all our presenters for being with us today. And now I'd like to turn it over to Captain Antonio Neri. Tony, please proceed.
Public health roles in wildland fire opening slides.
Thank you so much, Anna. My name is Tony Neri. I'm the Chief Data Scientist at the Division of Environmental Health Science and Practice here at the National Center for Environmental Health. I've been an active wildland firefighter and volunteer physician for the state of Georgia for the last decade or more in the wildland fire programs. And I'm so excited to have USDA, Department of Interior, EPA, and CDC present together on this vital topic for the state, local, tribal, and territorial agencies. One of the things that we hope you get, as Dr. Svensson said, is just a better understanding of where federal agencies are working on wildland fire and where the gaps they see in the activities they're undertaking. Next slide, please.
What public health activities relate to wildland fire?
I found it easiest and to align with a lot of the land management approaches of public health activities is that they relate to wildland fire in terms of prevention, preparation, response, and recovery. Next slide, please. Our colleagues at USDA, Department of Interior, and EPA will talk a lot more in depth about these following topics, but I did want to focus on that prevention, and particularly the use of prescribed fire or proactive use of fire, is an increasing focus for the land management agencies across the United States. In preparation for wildland fires, there's been a lot of materials that EPA will cover and CDC has contributed to in regards to wildland fire smoke, which is a predominant topic for wildland fire in the past and will be in the future. And below that, you can see a box fan, a do-it-yourself box fan. The EPA will talk about their work on that. Next slide, please. In response, unfortunately, a lot of public health agencies and their communities are involved in response activities for wildland fire, and in so being in catastrophic places at times. But public health agencies have no choice in those regions, particularly in the West, to be involved in the response of active wildfires, whether that's making sure evacuation routes are running correctly or ensuring shelters are in a good spot and adequately staffed and have adequate services available, and getting the people out as well as the firefighters in. Public health agencies are likely involved in that by choice or by force. Next slide, please. And then sadly, there's been a number of catastrophic wildfires, and hopefully those will decrease over time with the use of prescribed fire. But public health agencies particularly get involved in those areas. On the bottom, you can see the damaged wellhead, and as well as the open water line in a destroyed home. So after a fire goes through, public health agencies get involved not only in the entirety of the watershed and how it's providing clean water to the area, but the recovery of the community as far as not only physical infrastructure, but their mental health needs, the shelter needs, and not only the identification of hazardous waste, but the removal and re-permitting of locations in which they can restore functionality to a community and help them get back on their feet. Next slide, please. So in entirety, public health has a lot of roles, whether they're brought there by choice or by force. And this next series of speakers will talk about those more in depth. Next slide. Unfortunately, for a lot of the nation, there's no, at least at the federal level, there's no dedicated line item funding for a lot of this work in wildland fire, particularly from the public health agency standpoint. In prevention and preparation, there's no direct funding for CDC, and then I don't believe there's any direct line item funding for state, local, tribal, and territorial response agencies, public health agencies. Where public health agencies sometimes get involved is when the Federal Emergency Management Agency enacts a federal declaration of disaster for response or recovery. That's under ESF 8. And so feds can get more involved, particularly CDC and its sister agency, the American Association, the Agency for Toxic Substances and Disease Registry, ATSDR, can get involved in disaster response. You can see in the chat with, we'll put up here soon, that there is funding just this year in the 2024 to 28 budget for the Public Health Emergency Preparedness Program Cooperative Agreement, where there has been increasing recognition of the role of emergency response in public health agencies. And we will try to get, that's where CDC is trying to get more funding available for all of these roles in the prevention, preparation, response, and recovery. In addition, you'll see USDA and Department of Interior, as well as EPA, will provide another resources that state, local, tribal, and territorial public health jurisdictions can use to help improve, protect, maintain, and improve the health of their communities. Next slide. So one of the things we are interested in public health is make sure we have adequate staffing and resources for the problems of the day and problems of the future. And certainly wildland fire is both a problem of the day and problem of the future. So as a partner in the Wildland Fire Leadership Council, as well as a number of other agencies, places, and cooperatives, CDC has been working hard to try to highlight the work for public health in this entire world of wildland fire. So hopefully in the near future, and our partners will talk a little bit about this, the Wildfire Management Mitigation Commission, the Wildland Fire Leadership Council, and other areas, as well as the Community Wildfire Defense Grants and other funding opportunities for the state, local, tribal, and territorial health agencies involved. And that will hopefully help improve public health's ability to prevent, prepare, respond, and recover from wildfires. Next slide. With that, I'll hand it over to Pete Lom and Brett Anderson, Department of Interior and the Department of Agriculture. Thank you.
The land management perspective of population health burden and impact of wildland fire. Most photos in this presentation are borrowed from the Wildland Fire Mitigation and Management Commission's final report.
Okay, Pete Lom here from the U.S. Forest Service. I'm going to apologize to everyone. I'm not going to put my camera on. The bandwidth is much better served by having the camera off. Thank you for the opportunity to be here addressing you all today, and welcome. I do want to cover some of the intersection of the wildland fire management activities and the conditions of our landscape in the United States, and how it intersects with the public health side of our business and the populations that are impacted therein. I'll speak about a number of factors, including that intersection, how we respond, and also address some of the perfect setting from Tony a moment ago. Next slide, please.
Photo of a fire and smoke on a terrain map. Understanding the population health burden of wildland fire. Source: USDA Wildland Fire Mitigation and Management Commission Report, September 2023. https://www.usda.gov/sites/default/files/documents/wfmmc-final-report-09-2023.pdf.
So a wildfire occurs. Unfortunately, this is the Camp Fire a number of years ago in California. Next slide.
On the photo, Chico, California is marked at the top right, above the fire. Paradise, California is marked at the center of the fire.
And the intersection of this is a direct intersection, unfortunately, for all the communities downwind of that smoke. And that smoke in this picture is a little bit shy of how big those impacts were, because a lot of the coastal area of California, San Francisco, and many other communities well immersed in the smoke during this particular incident, as well as the peripheral smoke that you see in hitting Chico, California. Wildfire definitely affects those who are evacuated in the nearby sense, in the drainage flows that happen around most wildfires, but also long-range transport. Next slide, please.
A line graph titled U.S. Wildfire Hectares per Year 1985 to 2019. On the horizontal axis, years from 1985 to 2015. On the vertical axis, 0 to 4 million hectares. The data shows a 4 times increase from 1985 to 2019. 1 hectare equals 2.5 acres. Burned area trend equals 70,000 hectares per year. Source, Burke M., Driscoll A., Hafneel S., Shui J., Bernie J., Wara M. The Changing Risk and Burden of Wildfire in the United States. Proceedings of the National Academy of Science of the United States of America, 2021.
So, everyone is pretty well aware of the level of increase of burned area that's been happening in the United States for a number of years now. And this graphic doesn't even show the record-breaking year of 2020, but the increase is substantial over the last 25 years. And we seem to be continuing in that thread. We've had a little bit of a respite in 2020 and 2022 and 2023, but we are ramping up literally as we speak. And the program that I lead is responding to some of that smoke that's out there right now, and some of you may be experiencing. Next slide.
Canada. 18 million hectares in 2023. About a 6-fold increase over average.
So we can't forget a couple of other contributors in 2023, as Tony was mentioning a moment ago, a substantial impact from a very, very large impact from Canada, where 18 million hectares burned, 6 times their average in the past years, like this situation in the U.S. And I should point out, next slide, that that's about the size of the state of Washington in terms of the actual number of acres and hectares that were burned. I don't want to lose sight of the fact that it's not just Canada that can influence U.S. air quality and our populations. It can also, and it frequently was this past spring, smoke coming from Mexico. And if you look at a tool that I'll show in a moment, the fire and smoke map, you will see impacts happening right now from Canada in the mid part of this country. And there are a lot of wildfires that are very active in Alberta as we speak. So we could probably anticipate some of this continued national exposure to wildfire smoke. Next slide.
A line graph titled U.S. Wildfire Suppression Costs 1985 to 2019. On the horizontal axis, years from 1985 to 2015. On the vertical axis, costs from 0.0 to 3.0 in billions of dollars. The data shows an increase from 1985 to 2019. Greater than $38 billion in 2019. Suppression cost trend equals $60 million a year. Source, Burke M., Driscoll A., Hafneel S., Shui J., Bernie J., Wara M. The Changing Risk and Burden of Wildfire in the United States. Proceedings of the National Academy of Science of the United States of America, 2021.
So one of the points here absolutely is the increased cost, just like everything else in terms of suppression. But this is just a small tip of the iceberg when it comes to the real costs of wildfire in the United States. And Tony kind of pointed that out in the restoration and the recovery portion of after a wildfire. Not only is it what's being burned and people losing homes and the resources therein, water quality, the environmental health hazards that emerge after a fire, all those are absolutely critical and not captured in this particular graphic. Next slide. So let's talk about aligning how we bring this wildfire and how we address our wildlands and their conditions as they are today with trying to bring in the public health objectives, obviously of reducing impacts on all of the folks out there across the landscape. I shouldn't forget, this is definitely a public health objective, is also addressing the health of our fire personnel, the first responders that are dealing with this as well. In March of 2023, the General Accounting Office put together a report and released it on this intersection of land management and public health impacts of wildfires. It is a critical report that kind of points out many of the trends that was just mentioned a moment ago on the previous slides, but sets up the need for this alignment, this important recognition of land management and public health objectives working together, and the value of doing something like we are today, which is a multi-departmental effort, an agency effort to start addressing these challenges around wildfire and prevention and public health objectives. Next slide.
Land management efforts are guided by several frameworks. Covers of 3 documents. Confronting the Wildlife Crisis by the U.S. Department of the Interior. The National Cohesive Wildland Fire Management Strategy. On Fire, the report of the Wildland Fire Mitigation and Management Commission.
Critical recognition of the state of our lands across the United States is a very big step in this process. Since 2011, the National Cohesive Wildland Fire Management Strategy has been in place in the recognition of fire on the landscape, of addressing safe firefighting strategies, and preparing communities to address wildfire across the landscape. In the couple of years ago, the Forest Service and the Department of Interior issued clear recognition of their plans to address the wildfire crisis that's going on out there. And how do we do that? And it was a very clear recognition of the need to treat fuels, that is the natural vegetation and its buildup, recognition of the condition of the lands in terms of the available fuels that are out there, the risks of not doing that, and come up with ways of moving that issue forward. A lot of that, including the cohesive strategy, played a very big effort in the commission, the Wildland Fire report of the Wildland Fire Mitigation and Management Commission, that very closely and very succinctly looked at some of the smoke challenges around wildfire, and in fact got to the point that recognizing in words and very clear text, the wildfire crisis is a public health crisis, and that they are inexorably entwined, and responding to wildfire has got to also include responding to the wildfire smoke impacts on public health. Next slide.
Land management pre-wildfire. Photos of fire professionals at controlled burns labeled cultural burning and prescribed fires. Photos of sheep and cows grazing on land.
So how do we do that? How do we move forward from where we are today in the landscape where we are facing a wildfire crisis? And so there is the opportunity to address our lands and the fuels that are there and the risks that are present in the wildlands of the United States. Increasing cultural burning is one tool that is absolutely on the increase, using natural systems such as grazing to reduce fine fuels, another, but most critically is the role of prescribed fire. And prescribed fire not only reduces fuels, but plays a very natural process in many ecological systems across the United States. In fact, a majority of the lands across the United States have some role of fire. It may be frequent or it may be infrequent, but fire is part of the landscape. And it is an incredibly important tool for managing invasive species and also maintaining the populations of endangered species. Next slide.
Land management post-fire. Photos. Reseeding. People walk through a fire-damaged forest. Monitor recovery. A person sits in a field of green grass among fire-damaged trees. Reduce invasive species. Goats on land. Restore access. Water and boulders block a building. Monitor water quality. A person takes a sample from a running water source.
So the benefits of obviously taking on this big challenge of the wildfire crisis is trying to avoid what we're looking at on this slide. The need to recover, the need to address the risks downstream of a large wildfire, which with it brings incredible hazards and for flooding and massive soil movement, and unfortunately a number of fatalities that can result when these floods happen. Just making the movement of water much, much worse, even though it might be a light rain. It also influences water quality, and it has definitely significant effects on species, types, and how they will be coming back on a specific site. As you see an example here with reseeding and then monitoring that recovery. The damage is long-term. The damage is critical to keep track of, and is also very expensive and leaves many other environmental hazards if it is in an area that has homes and other infrastructure. Next slide.
Memorandum of Understanding for Wildland Fire and Air Quality Coordination. Signed to protect communities from the impacts of smoke while promoting land management practices that reduce the risk of large, severe wildfires. Logos for USDA, Department of the Interior, CDC, and Environmental Protection Agency.
So one of the clear steps that these agencies and departments, USDA, DOI, CDC, and EPA, they recognized this while they were going through the commission process and the GAO report of the importance of coordinating around wildland fire and air quality. And how to do that best was to be very clear in creating a memorandum of understanding that allows for bringing this particular issue into focus and working on it in a cross-agency, cross-departmental manner. And really, it's about reducing the risk of large, severe wildfires, but also addressing these public health impacts as well, which are just as large as these wildfires themselves. Next slide.
Areas of focus fiscal year 24 to 25.
One of the key elements is there is actually a work plan associated with this and community preparedness, and I'll talk about that in a moment, ensuring that we work together and there are mutual goals and efforts, the importance of sharing data across all the different agencies and understanding where there are gaps, and then how do we communicate effectively? And today's presentation is absolutely part of this effort that you are seeing and a product that is working together under the MOU. Next slide.
Photo of a burn. Photo source, NPS using prescribed burning for fuels management in Yosemite National Park.
So one of the important elements of that MOU and also the findings of the commission and the investment of the Wildland Fire Leadership Council, which crosses many departments and agencies, is just that there's going to need to be a strategic increase of using prescribed fire. And this is really to get at reducing the catastrophic wildfires that we're facing. And it's going to take some time, and it's going to mean a little bit more smoke in the air from prescribed fire. And we'll talk about what that means in a moment and the differences between wildfire smoke versus prescribed fire smoke in the context of landscape and land management. Next slide.
2 3-panel illustrations. At top, fire-excluded forest from historic wildfire suppression. First, a dense forest. Then, the forest on fire from ground to tops of trees. Finally, entire forest burned. At bottom, restored forest with fuel reduction treatments. First, a forest with spaced trees and underbrush. Then, the underbrush is on fire. Finally, the underbrush is burned and trees remain standing. Source, The Nature Conservancy. https://www.nature.org/n-us/what-we-do/our-priorities/protect-water-and-land-slash-land-and-water-story/y-we-work-with-dash.
So when one has an untreated forest, an area where fire has been suppressed and there has been a long-term buildup of the fuels, you wind up with a density that is above the natural historic variation. You wind up with a opportunity for the fuels to allow for crown fires to climb up from the ground and into the crowns of the trees. And you can see on that slide on the top right that you can really devastate an area and totally result in a potential type change of that environment. Whereas with fuels reduction methods, which can include removal of fuels mechanically, but also a critical element, which is the use of fire in a low intensity manner under very controlled conditions by professionals that are trained to do that within, say, a Forest Service or the Department of Interior, bureaus and agencies, that you can control and manage some of these fuels. and create a more resilient, a fire resilient type of ecosystem, and one that is in somewhat of alignment of how that ecosystem had worked historically before fires were excluded, before we were in the extreme situations of where we are now in this wildfire crisis strategy. So we optimally have this scenario like the bottom right corner, which is a desired state and to operate and can be maintained effectively with small, low levels of emissions rather than the months-long high levels of emissions, which are totally unmanaged in the example on the top line. Next slide.
An aerial view of a forest. At the top, no treatment equals high-intensity fire. In the center, thinning and prescribed fire equals minimal fire intensity. At the bottom, thinning only equals moderate fire intensity. Thinning and prescribed fires from the Klamath Tribe's Black Hills Restoration Project. Sources: Bootleg Wildfire, July 2021. Steve Rondo, Director, Klamath Tribe's Natural Resource Department.
So this slide is actually an important one because it kind of points out that unfortunately, in terms of emissions, prescribed fire is absolutely a critical step to the evolution and the ecology on these sites. Unfortunately, in this particular wildfire, Bootleg Fire of 2021, you can see the results very clearly of what no treatment results in, where there hadn't been fire, there hadn't been mechanical treatments and fuels treatments. They had a high intensity crown fire, devastating results. You see literally consumption right down to the ground and the blackened area. In the foreground, the thinned area did moderate the intensity of the fire somewhat, but the bottom line is that you see all the mortality of these standing trees. A very, very hazardous and challenging area to address in the future, I will point out. But in the middle is what you see is thinning plus prescribed fire. Fire did go through this area as well, but it stayed on the ground, and there was the maintenance of live material and live trees, and a working ecosystem that resulted from the prescribed fire and thinning. And then with the follow-up wildfire, it still continues to be resilient and functioning. This is a really important message because this is part of the drive of why we will probably be seeing in a lot of areas increased use of fire coupled with other fuels treatments to try to get to this state of a resilient, long-term, working, and effective ecological system for those areas where fire plays a role naturally. Next slide.
2 photos side by side.
We should point out some significant differences. I will leave to EPA some of the differences in terms of actual public health impacts and some of the other more technical pollutants dialogue. But very simply, on the left, you see a prescribed fire, and Tony put this slide in because he's involved in a number of prescribed fires in Georgia. Thank you, Tony, for your investment and time. But in the prescribed fires in Georgia, you can see, and this is in an area where fire has played a natural role, and they put prescribed fire in the landscape on a fairly regular basis in line with the ecological needs of the site. And the smoke is fairly low. It is fairly light. It is not dispersing very far, probably about a 3,000 to 4,000 foot height on that plume. And it dissipates within several hours, and some residual smoke may be around for 24 hours, and then it's gone. And it is managed to try to minimize the effects on downwind communities. So that smoke is actually timed to try to minimize population exposure. And this is part of the policy of both DOI and the U.S. Forest Service to use basic smoke management practices. And this is used also by many other entities and training that's done for prescribed fire burn bosses. Compare that to a wildfire situation. And I'm guessing that Tony had to go back a couple of years on this particular slide to pull up this wildfire situation, because the number of large wildfires that's happened in the last few years in Georgia has been quite small. But when it does happen, it is substantial. And you can see the height here of the plume, the density, the lack of control. The duration is there for quite a while. And I'm thinking about Thanksgiving of 2019, I think it was, or maybe 2017, there were some big wildfires. Some real challenges here when you're downwind of a wildfire. And for all of our Western participants in this call, some of you are experiencing some of this wildfire smoke right now, and the duration of which you have no idea, and nor do we. as we respond to these types of incidents. So there is an option of some management on the left versus this unmanaged, very challenging public health and wildland fire management situation on the right. Next slide.
IWFAQRP link, https://www.wildlandfiresmoke.net.
So I'm going to be very brief here. There is efforts to address smoke response on large wildland fire incidents. It's the program that I lead called the Interagency Wildland Fire Air Quality Response Program. And I hope as public health professionals on this call that there are a number of intersections that you've had with our air resource advisors who are assigned to the incident command teams that are on these large wildfires. They go out, they put out air quality monitoring equipment that we have in a national cache. We try to predict the smoke dispersion and smoke impacts and coordinate with air quality agencies as well as public health agencies in terms of messaging, and also jointly creating a communication strategy around those air quality risks. You can see the tie-in here in terms of the link, and hopefully you'll check this out later. Next slide.
Photo of AUSFS Air Resource Advisor monitoring air quality during a wildfire with a large machine. Image of the AirNow US Air Quality Map, May 14, 2024. Green, yellow, and orange dots fill the map of the U.S. A key tool for addressing wildland fire smoke information for the public is EPA, USFS Fire and Smoke Map, which is where the Air Resource Advisor smoke outlooks are also posted for the affected public. Source USDA, https://fire.airnow.gov/.
And so one of the tools that was a joint development with USDA and Forest Service and the response program is the fire and smoke map. My colleagues from EPA will go into a little bit greater depth on the map, except I hope that this is a piece that you all use and look at every day to understand where smoke is going, what the conditions are, and how people may respond to that smoke impact. And also, the smoke outlooks generated from our air resource advisors are on this map as well. So if you're located within, say, a box of the forecast, such as around the Pioneer Fire up in Washington, if you went to this site right now, you would see a smoke outlook for the next several days, and hopefully providing a means for how to live with the smoke, which is a real challenge for everyone. Next slide.
Preparedness for wildfires. USDA Community Wildfire Defense Grants. Link, https://www.fs.usda.gov/managing-land/fire/grants. Fire Adapted Communities. Link, https://fireadapted.org. Interagency Wildland Fire Air Quality Response Program. Link, https://www.wildlandfiresmoke.net/smoke-ready. Smoke Ready Communities.
One of the other tools that we're looking at, and this is the opening side, is this idea of community wildfire defense grants. There is the opportunity for the next couple of years still. There's been several rounds of this community wildfire defense grant, but community wildfire protection plans are being redeveloped or redone, and new ones are being built. And smoke can fit into that, so the communities can build some resilience around the smoke issue and embrace what's known as smoke-ready principles and become a smoke-ready community. So do look at that opportunity, and public health agencies and departments and entities on this call can engage in that process. And the Community Wildfire Defense Grants, a number of grants this most recent round, does take into consideration and include smoke. Fire adapted communities being ready for wildfire, absolutely critical, and then the interface with the response program as well. Next slide, and I think we'll be turning it over to Brett Anderson from the Department of Interior Bureau of Land Management. It's all yours.
Thank you, Pete. In summary, I said Pete Lom's portion of this presentation demonstrates that land managers understand that this entire system is under tension as we're trying to, bring more fire on the landscape to deal with the wildfire crisis that we are experiencing, while being mindful of the fact that there are health threats from increased use of tools like prescribed fire that they can present.
Photo of a prescribed fire by the U.S. Fish and Wildlife Service.
Through the Wildland Fire and Air Quality Memorandum of Understanding and other guiding frameworks, federal agencies are jointly working to assemble a large group of partners to define solutions as we move forward. The bottom line is that we cannot continue with the status quo. We must be more proactive in our approach to addressing the wildfire crisis, or we will continue to face large, severe wildfires and their associated public health impacts. As Pete had demonstrated, I said the Interagency Wildland Fire Air Quality Response Program represents a vital link between aligning land management agencies' efforts with respect to wildland fire response and nascent efforts to include air resource advisors from the response program on critical prescribed burns and the associated public health and air quality messaging that is necessary through that. The response program is truly a multi-agency effort with a total of 117 ARAs from across multiple agencies, 47 from Forest Service, 16 from Department of Interior, 12 from EPA, 7 from state and local air quality agencies, and 2 from CDC. Additionally, both USDA Forest Service and Department of Interior have developed multiple smoke positions dedicated to help our respective departments navigate the challenges of both air quality regulations and associated public health concerns. For the program that I lead, which is the BLM Air Resources Management Program, we are also working within our respective agency, the Bureau of Land Management, and our partners in the Fire and Aviation Directorate to develop a joint service model where atmospheric scientists from within my program can assist with smoke modeling similar to the response program functions to support BLM prescribed fires and also liaise with state air quality agencies and public health agencies. So, next slide. So we'll turn this over to our partners from the Environmental Protection Agency.
Thanks, Brett. Appreciate that. Thanks, everyone. I'm Jason Sachs at the EPA, and I'm going to kick off this part of the presentation talking about wildland fire, smoke, and public health, and then I'll turn it over to my colleague, Sarah Cofield. Next slide, please.
EPA disclaimer. The views expressed are those of the authors and do not necessarily reflect the views or policies of the U.S. EPA.
I just need to display this disclaimer too, as CDC did earlier. Next slide, please.
What is the biggest risk to public health from wildfire? Smoke. Top map. It's not a local issue. 2 side-by-side color-coded images of the U.S., A from 2006 to 2008, B from 2016 to 2018. The colors from blue to purple to pink to yellow show the predicted increase in median PM from smoke. Source, Burke et al. 2021. Proc National Academy of Science U.S.A. January 12, 118 Open brace to close brace. At the bottom 2 maps of the U.S. with colored coded dots. Source, U.S. EPA and U.S. Forest Service. Fire and smoke map open brace 9/15/2023 close brace and open brace 6/7/2023 close brace.
As you saw in the previous presentation that Pete gave, there's been a dramatic increase in the acres burned due to wildfire over the last approximately 30 years, which has had well-documented and devastating impacts on many individuals and communities. However, when we think about this from a public health perspective, the biggest risk is from the smoke emitted. And while smoke concentrations will tend to be higher closer to the fire, smoke can travel far distances, impacting communities and people near and far from the fire. And this has been further highlighted by multiple recent scientific studies that have shown substantial increases in smoke nationally in more recent years, such as the Burke et al. Paper at the top of this figure, but also during some of the more significant wildfire events where smoke has blanketed large portions of the country, which you can see on the maps on the bottom of the slide. And while this slide focuses on the continental US, it's important to recognize that Alaska experiences smoke every year, and we also had the devastating fires in Maui of last year. Next slide, please.
Air quality improves in U.S. from 1988 to 2016, except in wildfire-prone areas. A color-coded map of the U.S. shows worsening air quality and increasing annual PM 2.5 concentrations in the northwestern U.S. and improving air quality and decreasing annual PM 2.5 concentrations. Source, McClure CD and Jaffe Dia Open Brace 2018 Close Brace PNAS 115 Open Brace 31 Close Brace 7901-79. Line graphs and a map show that some regions of the country are experiencing an increase in annual PM 2.5 concentrations.
The increase in acres burned and subsequently the smoke emitted on a yearly basis is also having broader air quality and public health implications. We are starting to see a trend of reversing decades of improvements in air quality, primarily in the Western US, which is reflected in a few recent scientific studies that are depicted on this slide, where you can see annual particulate matter concentrations, a main component of smoke, are being increased in many locations. And this is a perfect segue into a broader discussion about smoke that I'll touch on in the next few slides. Next slide, please.
Wildland fire smoke. Complex mixture. Particulate matter. Carbon dioxide. Carbon monoxide. Organic compounds. Oxides of nitrogen. Trace metals. Water vapor. Photo of smoke obscuring the San Francisco Bay and Bridge. Credit, Lands End, San Francisco, California. Campfire, November 2018. Picture by Wayne Cassio.
Wildland fire smoke, and I note wildland fire here to reflect smoke from both wildfire and prescribed fire, is a complex mixture that includes a number of pollutants, of which particulate matter, also referred to PM, is one of the biggest contributors to smoke and the pollutant of greatest health concern. Next slide, please.
Example, NO2 or SO2 emitted by sources such as power plants, automobiles, etc.
But what is PM? Well, it's a mixture of solid and liquid droplets. Particles can be directly emitted from a source such as a smokestack or vehicles or wildfires, or the particles can form through complex atmospheric reactions of chemicals that are emitted from some of the same sources that directly emit PM. PM is classified into different size fractions based on the aerodynamic diameter of the particle, but each of these size fractions still represents a distribution of particles that people are exposed to. And so of these different size fractions, fine particles, which are also referred to as PM 2.5, is the size fraction of greatest health concern. And this is because these particles can be easily inhaled into the body, where they can reach the lower regions of the respiratory tract. And some of those particles can reach then the lower regions of the lung, where they may translocate into the bloodstream and can affect other organ systems. And so to put the size of these particles into perspective, for PM 2.5, these particles are about 30 times smaller than the size of a human hair.
Coarse particles open brace PM 10 to 2.5 close brace, aerodynamic diameter generally greater than 2.5 microns and less than or equal to 10 microns. Ultrafine particles open brace UFPs close brace, aerodynamic diameter generally less than or equal to 0.1 microns. Diagrams shows human hair at 50 to 70 microns in diameter. PM 2.5. Combustible particles, organic compounds, metals, etc. Less than 2.5 microns in diameter. PM 10. Dust, pollen, mold, etc. Less than 10 microns in diameter. Fine beach sand, 90 microns in diameter. Source, https://www.epa.gov/pm-pollution.
Next slide, please.
Health effects and outcomes associated with wildland fire smoke. Decades of research on the health effects of ambient open brace typical close brace PM 2.5 exposures. Short-term open brace days to 1 month close brace and long-term open brace 1 month to years close brace exposures. Strongest evidence. Cardiovascular effects. Respiratory effects. Mortality. No threshold or concentration below which health effects do not occur. Short-term smoke exposure. Irritation of the eyes and respiratory tract. Respiratory symptoms. Coughing, phlegm, wheezing, difficulty breathing. Respiratory effects. Bronchitis, reduced lung function, increased risk of asthma exacerbation and aggravation of other lung diseases, increased risk of emergency room visits and hospital admissions. Cardiovascular effects. Heart failure, heart attack, stroke, increased risk of emergency room visits and hospital admissions. Increased risk of premature death. Source, Liu et al. Open Brace 2015 Close Brace, Reed et al. Open Brace 2016 Close Brace, Cassio Open Brace 2018 Close Brace.
So it really hasn't been until about the last 10 years that we've had an expansion in the number of studies that are examining the health effects of wildland fire smoke. And for the most part, the focus has been on wildfire smoke. But while the wildland fire smoke literature is relatively new, it's rapidly expanding. However, this doesn't mean that we don't have a good sense of the health implications of wildland fire smoke exposure. We have decades of research examining both short and long-term exposures to ambient PM 2.5. And by ambient, I mean exposures that occur during a typical day and not an extreme event like a wildfire. And these studies of ambient PM 2.5 provide a rich and extensive evidence base that is the starting point for what we know about wildland fire smoke. The focus on wildland fire smoke and health has tended to be on short-term or daily exposures and health effects. And it's from this large body of evidence that we know that there's no concentration of PM 2.5 below which health effects do not occur. Smoke exposures can lead to a range of health effects from less serious, such as eye irritation and a runny nose, to more serious, such as the exacerbation of pre-existing respiratory and cardiovascular diseases, and even premature death. And this slide captures a bunch of the other health effects and outcomes that we've seen associated with smoke as well as ambient PM 2.5. Next slide, please.
Long-term exposures to ambient air pollution does not equal long-term exposures to wildland fire smoke. A Venn diagram with overlapping circles labeled frequency, duration, and intensity. Source, adapted from Casey et al. Open Brace 2024 Close Brace. https://doi.org/10.1073/pnas.23067292121.
Although our focus has tended to be on short-term daily smoke exposures, in part due to smoke impacting people on a yearly basis, we are starting to see studies conducted that try to assess the health implications of exposures occurring within and across years. And in thinking about these other exposure durations of smoke that people and communities may experience, it's important to recognize that the types of exposures we often focus on in understanding the health implications of ambient air pollution from longer duration exposures are different than what is experienced with smoke because of the highly temporal variable exposures that occur during smoke events that vary in frequency, duration, and intensity. And I mention this because while studies of short-term daily ambient PM 2.5 exposures that we talked about in the previous slide have been extremely influential in conveying the public health implications of smoke exposure, it's because of the highly variable smoke exposures that occur within and across years that we know less about the health implications of these other exposure durations. And this is an area of active research to help support more tailored public health messaging around different smoke exposure durations. Next slide, please.
Who's at risk from wildland fire smoke? People with chronic diseases. People with asthma and other lung diseases. People with cardiovascular disease. Life stages and populations. Older adults greater than 65 years of age. Children less than or equal to 18 years of age. Pregnant people and developing fetus. People with higher exposure. People from some ethnic and racial minority groups. People with lower incomes. Outdoor workers. Source, US EPA Open Brace 2023 Close Brace Wildfire Smoke Fact Sheet. At-risk groups of people.
So similar to our understanding of wildland fire smoke and health overall, our understanding of those populations at increased risk of potential health effects is rooted in evidence from studies of ambient PM 2.5. And so people may be at risk or increased risk of health effects due to inherent factors that may predispose them to experience a health effect, or in response to being exposed to higher concentrations of PM 2.5. And this latter point is important in the context of wildfire smoke because some populations, such as people of low socioeconomic status or outdoor workers, they may not have the means available to reduce or mitigate exposures. They might not be able to go buy a clean air purifier for their home or get out of the smoky conditions during working. And so lastly, it's important to recognize that everyone will respond differently to wildfire smoke exposure. And the presentation of health effects in response to smoke exposure can vary. It may be immediate or present a few days later for some individuals. Next slide, please.
Find current and forecasted conditions. Air Now Fire and Smoke Map. https://fire.airnow.governor screenshot of a map of North America with green, yellow, and red dots. Sample data from Corpus Christi. Source, U.S. EPA and U.S. Forest Service. Fire and Smoke Map Volume 4 Open Brace 6/05/24 Close Brace.
And so at this point, I'm going to turn it over to my colleague, Sarah Cofield, who's going to pick up the rest of the presentation.
All right, thanks, Jason. So if you're in a smoke event, it's very important to pay attention to your current and forecasted conditions. And Pete gave you a great intro to the Fire and Smoke Map, which is a collaboration between our agencies. And this map provides near real-time data from permanent and temporary monitors, as well as low-cost sensors, so you can keep an eye on what's happening to your air quality in a nice current status. You can also see daily smoke plume overlays to give it an idea of like where the smoke's coming from and how it's changing from day to day. And if you are in an area that's covered by an area resource advisor, you can get those forecasts that Pete was talking about. But it is important to understand some folks are going to be affected by smoke, but won't be covered by an area resource advisor because their forecasting area is about the area really closer to that fire. And as we've seen, smoke can travel super far. So you may have yourself a state or local smoke blog that would provide some of that forecasting information that'd be really useful for you. I know that a lot of Western states have these, like Montana, Idaho, Washington, Oregon, have state smoke blogs where you can get that those forecasts for your area. One thing I want to point out is this screen grab right here is from the next version of the Fire and Smoke Map that should hopefully have a soft launch next week. And when that goes out, you will need to toggle that smoke overlay. The versions you've seen previously are the current one where it just automatically has the smoke overlay. But when this version goes live, you will need to toggle on that smoke overlay. So just kind of keep that in mind. But the Fire and Smoke Map is a really excellent way to get a really good understanding of what your current air quality is. Next slide.
Air Quality Index. AQI basics for ozone and particle pollution. A color-coded chart with columns labeled daily AQT color, levels of concern, values of index, description of air quality. Row 1, green, good, 0 to 50, air quality is satisfactory, and air pollution poses little or no risk. Row 2, yellow, moderate, 51 to 100, air quality is acceptable. However, there may be a risk for some people, particularly those who are unusually sensitive to air pollution. Row 3, orange, unhealthy for sensitive groups, 101 to 150, members of sensitive groups may experience health effects. The general public is less likely to be affected. Row 4, red, unhealthy, 151 to 200, some members of the general public may experience health effects, members of sensitive groups may experience more serious health effects. Row 5, purple, very unhealthy, 201 to 300, health alert, the risk of health effects is increased for everyone. Row 6, maroon, hazardous, 301 and higher, health warning of emergency conditions, everyone is more likely to be affected. Source, https://www.airnow/aqi/aqi-basics/.
So you see a lot of colors on that Fire and Smoke Map, and those correspond to the Air Quality Index, which is an index the EPA designed as a way to communicate to people current air pollution levels and health concerns, and when people should start taking actions to reduce their exposure. It takes the concentrations of pollutants and puts it on a scale where 100 is that demarcation between satisfactory air that meets the National Ambient Air Quality Standard for short-term exposure and what we consider unhealthy air quality. So for PM 2.5, that's going to be our main pollutant during wildfire smoke. So that's where you can be seen for the AQI on that Fire and Smoke Map. And as you get further up the AQI and you get deeper into those colors, the air quality is worsening and more people need to be taking measures to reduce their exposures to smoke and taking steps to stay healthy. Next slide. Next slide.
Protecting public health from wildland fire smoke. A diagram in 3 parts. A color-coded vertical spectrum line from most effective to least effective. An upside-down triangle with color-coded layers of personal actions. A list of limitations or concerns. At the top, most effective. Elimination, reduces exposure by 100%. Personal action. Relocation. Limitations. Relocation increases costs and stress and has unpredictable duration. Wildfire particulate matter and ozone may extend thousands of kilometers. Next effective. Engineering controls, reduce exposure by 20 to 90% depending on quality of filters or air cleaners. Personal action. Close doors and windows. Set air conditioners in recirculation mode. Use portable air cleaners with HEPA filter or central air conditioner with filters. Limitations. Effectiveness varies greatly with ventilation and filtration rates. Most filters reduce only particulate matter and not gaseous pollutants. Open brace example, ozone close brace. Cost is prohibitive for some. Next, effective. Administrative controls. Reduce exposure by approximately 50%. Personal action. Stay indoors. Avoid heavy or prolonged physical activity. Limitations. Strategies are less effective for leaky houses. Exposure to indoor air pollution. Open brace example, cooking smoke and aldehydes from paints and furnishings. Close brace is increased. Insufficient physical activity may lead to adverse health effects. Strategies are impractical for outdoor workers. Least effective. Personal protective equipment. Reduces exposure by greater than or equal to 90% if well fitted but nearly 0% if poorly fitted. Personal actions. Wear a face mask. Limitations. Only certain face masks. Open brace N95 or P100 close brace can reduce exposure to particulate matter. Effectiveness depends on fit, and fit testing is not generally available. Masks cannot protect against gaseous pollutants. Masks may provide a false sense of security and thus increase outdoor time and actual exposure. Masks may cause physical stress due to increased work of breathing, heat, and discomfort. Masks are not suitable for children, people with facial hair, and those with lung or heart disease. Cost is prohibitive for some. Source: Shu et al. Open brace 2020 close brace. Angle J Med 2020, 383, 2173 to 2181.
There we go. Now there are several steps you can take to stay healthy and reduce your exposure. And this great figure from Zhu et al. Gives us a nice kind of breakdown of what's going like most effective to less effective, as well as some of the limitations of these. Like the most effective way to reduce your exposure to smoke is to leave it behind you entirely. Let's just kind of get out of the area. But that's not practical for a lot of people. And sometimes that smoke is covering multiple states at a time. So where are you going to go? So if you can't leave the area entirely, it's a great idea to reduce your exposure by creating a cleaner airspace, by having a safe haven with better air quality. And we're going to get into that more next. If you can't do that, then just go inside and close doors and windows. That will still give you some protection. And we're going to reduce your activity levels. You're not breathing super heavy and taking a lot of that smoke into your body. And you can also choose to wear a respirator. And Tony will cover that more later at the end of his talk. Next slide.
Reduce indoor exposures. Create a clean room during a wildfire. An infographic with drawings of the interior of a home. Stove. Avoid creating smoke and other particles indoors from cooking, smoking, or burning candles. An air filter on a bedside table. Filter the air with a portable air cleaner that does not produce ozone. Window above the bed. Close windows and doors to prevent smoke from entering the room. Tabletop fan. Stay cool. Run fans or set your air conditioner to recirculate. If possible, use a MERV 13 rated filter. Close blinds and curtains. Choose a room that is comfortable and fits everyone. Having an attached bathroom is helpful, if available. Learn more at epa.gov/IAQ.
So how do we create these clean air spaces? And home is not that difficult. First, you want to make sure you're not creating your own air pollution. So cut back on some stovetop cooking. Don't burn candles and incense. You don't want to be introducing your own pollution into your space so you can avoid it. And then you want to clean that air. A great way to do this is with a portable air cleaner with a HEPA filter in it. It's going to remove those tiny particles in the smoke. You want to make sure that the air cleaner is sized appropriately for the room that it's in, and that it does not generate ozone, because ozone is very harmful for your health. Close the doors and windows to that space so the air can circulate through the filter, and you should be in pretty good shape. If you have a central air conditioning system, they can have an upgraded, more efficient filter put in. You can then clean all the air in your home and get cooling at the same time. One thing to note, though, is not all home HVAC systems are able to use really efficient HVAC filters, because it can cause a reduction of airflow across coils unless you have a more modern system that can compensate for that. So you need to do some research before you just put in that better filter. If your system can't use the better filter, then you want to use those portable air cleaners to create those clean rooms on kind of a room-by-room basis. And then I also want to point out that it is very important to be able to cool down your space when it's hot outside. And if you don't have air conditioning, that may mean opening your windows at night and letting the cool, smoky air inside, because heat is immediately dangerous. And then close your doors and windows when you get cooler, and turn on your air cleaners and clean out that smoke. Next slide.
DIY air cleaners. Bar graph with filters on the horizontal axis and clean air delivery rate in CFMs from 0 to 450 on the vertical axis. Data is included for filter and use variations such as MERV 13.1, corner, outlet, bungee, MERV 13.4, and MERV 11.1. MERV stands for maximum effective reporting value. Also data for smoke and dust. Then fan variations fan B, fan C, and then design variations of shroud, wedge, CR box, and commercial open brace turbo close brace. Specific options are circle. MERV 13.1 is good at CADR 100. MERV 13.4 is better at CADR 250. Shroud is better at CADR 150. Wedge is better at CADR 260. CR box is best at CADR 400. Photos of DIY air cleaner design variations. Box fan with air filters attached to the back. Basic with bungee. Wedge. Shroud and Corsi Rosenthal open brace CR close brace.
So, a portable air cleaner with HEPA filter is at its heart, it is a fan and a filter. So you can make your own air cleaner with a fan and a filter. This most basic version uses a 1-inch HVAC filter stuck on the back of a box fan, and you have yourself an air cleaner. One important note here is you want to make sure it's a newer box fan manufactured since 2012, because these have added safety features that take away the risk of overheating. Some older box fans have a greater risk of problems. So get a newer box fan and then use a MERV 13 filter. Now, MERV stands for Minimum Efficiency Reporting Value, and it's just a scale that describes the effectiveness of a filter at removing different sizes of particles. And the higher your MERV, the better that filter will do at taking out smaller particles. MERV 13 is actually the lowest MERV that has been tested to remove the really tiny particles in smoke. They're typically less than even 1 micron in diameter. So that's what we recommend is a MERV 13 filter. Now, we wanted to understand how these different contraptions, because you can make different contraptions out of your filters and your fans, how they stack up against each other. So we took them into the laboratory and tested a few different variations and found that just the basic box fan and one filter, it's about as good as a small commercial air cleaner. But as you add filters and make a larger contraption, you add surface area. So there's more air, more space for that air to flow through. You get more air movement coming through and getting cleaned more quickly. And you can use those in larger and larger rooms, because just the basic fan and filter, that's good for about a 150 square feet room. But as you get a larger contraption, you make more surface area with a box or a wedge, it's going to get better for larger spaces. And then another thing you can think about, if you want to have more surface area but less of a boxy huge thing, is a 4-inch thick HVAC filter, because that has really deep pleats that create that surface area and has also similar impacts to having like multiple filters on your device. But these are a great way to have a less expensive means of cleaning your indoor air, but do be aware they are louder than your basic commercial air cleaners typically. Next slide.
DIY air cleaners. DIY air cleaner to reduce wildfire smoke indoors. Basic design. Materials. 20 by 20 by 1 inch or 4-inch air filter. 20 by 20 inch box fan, only use certified fans with UL or FTL marking. 2012 model or newer. Clamps or duct tape or bungee cords. Assembly. 1. Attach the air filter to the back of the box fan using either clamps, duct tape, or bungee cords. 2. Check the filter for the direction of the airflow open brace marked on the side of the filter close brace. 3. Replace filters when dirty. DIY air cleaner designs beyond the basic. Good. Basic supplies. 20 by 20 inch box fan. 20 by 20 by 1 inch or 4-inch MERV 13 air filter. 20 by 20 inch cardboard shroud. Cut out the size of the fan blades. Clamps, duct tape, or bungee cords. Better. Additional supplies. 2 MERV 13 air filters. Triangle cardboard cutout for base on top. Best. Additional supplies. 4 or 5 MERV 13 air filters. If using 5 filter design, use leg supports such as blocks to allow airflow through bottom. Ways to improve effectiveness. Add a cardboard shroud as a no-cost improvement. Use thicker filters, 4-inch rather than 1-inch MERV 13 filters. Use multiple filters. Key reminders. Only use certified fans with UL or FTL marking. 2012 model or newer. Keep extra filters on hand. Replace filters when dirty. Webpage recently updated. Research on DIY air cleaners to reduce wildfire smoke indoors. FTL marking. 2012 model or newer.
We have a graphic about how to make these on our website. We do recommend you can take this, share it, distribute it, use it. We also have it in Spanish, just something as a resource out there for folks that aren't able or don't want to purchase a portable air cleaner. You can make your own. All right, next slide, please.
Commercial buildings and schools. EPA worked with National Institute of Standards and Technology Open Brace NIST Close Brace colleagues to propose ASHRAE develop wildfire smoke guidelines. ASHRAE is a global society advancing human well-being through sustainable technology for the built environment. Multidisciplinary team identified to develop interim planning framework for protecting commercial building occupants from smoke during wildfire events issued February 2021. Full guideline on protecting commercial building occupants from smoke during wildfire and prescribed burn events under development. Open Brace ASHRAE 44P. EPA's Wildfire Aspires study led to important insight into factors contributing to indoor PM 2.5 during smoke events.
So cleaning the air at home is actually relatively straightforward. It's more complicated in a commercial building because HVAC systems are designed in commercial systems to take outside air and bring it indoors. That is what they do. They take outside air, they bring it inside, and it's not required to be cleaned to any certain extent. We did a study, EPA, in California and Montana to get an understanding of what it's like inside these commercial spaces, offices, schools, fitness centers, preschools, museums, community centers, places people would go expecting clean air because it's air conditioned. And we found a lot more smoke than we wanted or expected to see. And we investigated this and learned some important lessons about what happens in commercial HVAC systems. And then we talked to ASHRAE, which is an organization that sets standards for HVAC maintenance. And they came to the table and they've issued a framework for how building operators can do a better job protecting their occupants. And they have really formal guidance will be coming out hopefully by the end of this year to really be detailed about what we can do better in commercial buildings about protecting occupants. But we have some information to share right now about that. So next slide.
Building factors affecting smoke indoors. Many structural and operational factors of the heating, ventilation, and air conditioning open brace HVAC close brace system can affect indoor air quality. Key points to keep in mind during smoke events. Type and condition of filters. Filters rated lower than MERV 13 do not significantly reduce the smallest particles found in wildland fire smoke. HVAC system operating hours/settings. No filtration occurs when the HVAC system is off since indoor air is not recirculating. Open brace. Same for thermostat settings that reduce use of A/C during nights or weekends. Close brace. Economizers may bring in large amounts of outdoor air, increasing indoor pollution when operating. Non-functioning HVAC components. Dampers that regulate the amount of outdoor air coming into the building may be damaged or not operating correctly. Older buildings with cracks and gaps around doors and windows may be letting in more smoke.
So some of the things that impact how much your air is being cleaned in a commercial building is obviously going back to those filters. Do you have a MERV 13 filter in your commercial HVAC system? Usually the answer is going to be no. We tried very hard to find buildings with filters above a MERV 8, and it was very hard to find any because MERV 8 is what's required, and it is cheaper. So not a lot of MERV 13s out there, but it's what we do recommend to be used. You want to make sure it's clean and that it fits in the filter casing. You also know, when is your HVAC operating? If you're turning off your HVAC fan to save energy, is typically a great idea, but during a smoke event, that means your air is not circulating through the fans, it's not circulating through the filters, it's not being cleaned. Similarly, if you're using an economizer in a commercial building to cut down on needing to use your air conditioning, which is typically great because it takes cool nighttime air and brings it inside so you don't have to run that air conditioning all the time. But during a smoke event, that is smoky, cold air that you're bringing inside, just dumping smoke straight into your building. So economizers can lead to more smoke buildup than you would like to see. And then there's the issue of non-functioning HVAC components and deferred maintenance. that we found when we did our study. So go ahead and go to the next slide.
Building HVAC inspections. Inspections of building characteristics and ventilation systems were conducted during the Wildfire Aspire study to better understanding factors affecting smoke infiltration and indoor air quality. Key findings included use clean filters rated for smoke open brace MERV 13 or greater close brace that fit in your HVAC system. Perform maintenance on HVAC system to ensure all components work properly. Steel gaps in the building envelope open brace around doors, windows, pipes, and conduits close brace. Close windows and limit door opening and closings and use supplemental air filtration during smoke events.
We went through and we inspected all the buildings in our study, and we found a tremendous amount of deferred maintenance, where there's the assumption that if your temperature is correct, then your HVAC is operating properly, and that's not always the case. We found a lot of dampers that were broken. Dampers control the airflow coming into your building. If it's broken open, there's nothing to stop smoke from coming inside. We found filters that were bent and crushed, and because it kind of jammed into the casing, so air just go around the holes. We found filters that were so overloaded, air couldn't go through them at all. We found filters that weren't even in MERV 8. We found some MERV 4s. We had gaps and breaks and holes in HVAC systems and leaky ducts, and then leaky doors and windows where smoke could come inside. All of these weak points that need to be addressed and assessed. So when you're doing a commercial HVAC system and you want to provide clean indoor air, you need to go through and take care of all these maintenance things and make sure it's operating correctly, and address the building envelope to make sure you're giving that safer indoor space to your occupants.
Resources for more information. EPA websites. Wildfires and indoor air quality in schools and commercial buildings. Wildfire Smoke, a guide for public health officials. EPA Wildfire Aspire study. Research on DIY air cleaners. Useful guides on filtration and wildfire smoke. Air cleaners and air filters in the home. Create a clean room to protect indoor air quality during a wildfire. Guidance for cleaner air spaces during wildfire smoke events. Information clearinghouse. Smoke Ready Toolbox. Continuing medical education open brace CME close brace courses. Particle pollution in your patient's health. Wildfire smoke in your patient's health.
Okay, so next slide. And finally, we have a lot of resources about all of this on our website. We're going to try to drop these into chat for you, just so you can go through and learn about the work we've done and what you can do to create those cleaner air spaces in your homes and commercial buildings. And with that, I'm going to wrap up and pass it off to Tony. Thank you so much.
Thanks, Sarah. We'll just finish up here with the public health rules in wildland fire, and we can go to the next slide.
A line graph. U.S. PM 2.5 levels by region 2000 to 2022. Years on the horizontal axis and average PM 2.5 in UG per M3 from 4 to 19 on the vertical axis. The lines of data are color-coded to regions: Ohio Valley, South, Northeast, West, Northwest, and Northern Rockies. WF smoke is driving PM 2.5 upward in western and northwestern states compared to a nationally downward trend. Source: EPA https://www.epa.gov/air-trends/particulate-matter-PM25-trends.
These slides just really highlight the things that Jason and Sarah had put together. You can see just general decline in PM 2.5 levels between 2000 and 2022. If you go to the next slide, it highlights the western states and northwestern states going up, and my arrows got a little bit off, but really that reversal in trend. And then combined with the next slide.
Line graph. U.S. percent of PM 2.5 from wildfire smoke by region 2005 to 2019. Years from 1985 to 2015 on the horizontal axis. Percent of PM 2.5 from smoke from 0 to 100 on the vertical axis. Lines of data for West and Northwest. Predicted percentage of PM 2.5 from wildfire smoke trend equals 1.36 percentage points per year. WF smoke contributes about 50% of PM 2.5 in western and northwest states. Source: Burke M., Driscoll A., Hefneel S., Shui J., Burney J., Wara M. The Changing Risk and Burden of Wildfire in the United States. Proceedings of the National Academy of Science of the United States of America, 2021.
Next slide. There you go. It really, that Burke paper really highlights the contribution that wildfire smoke contributes to the PM 2.5, the particulate matter less than 2.5 microns in diameter in the western and northwest states. And so I think not only is it impactful in the western and northwest states, but as you saw last year, and as will probably continue to be seen across the United States as there are bigger fires, more fires, that you will see PM 2.5 levels could be affected by things further out than the western and northwestern United States. Next slide, please.
Short and long-term health effects. Short-term/immediate. Exacerbate cardiopulmonary conditions. Visibility-related issues: open brace vehicle crashes, air traffic control close brace. Source: McCardle et al., MMWR, 2023. Long-term. Not clear/under study. National Firefighter Registry for Cancer. Website: https://nfr.cdc.gov/.
I wanted to highlight that not only EPA had done a lot of work on the short and term and intermediate effects, basically cardiopulmonary conditions that are exacerbated. One is that there's a link at the bottom by Kristen McCardle, our Epidemic Intelligence Service officer, that looks at syndromic surveillance for asthma visits during the Canadian wildfires, was one of those points. And I want to make sure we have time for just a couple questions. But the National Firefighter Registry is CDC's way in which we're trying to understand the longitudinal exposures that Sarah and Jason and Brett and Pete talked about, and put them into some understanding about the development of cancer from subsequent exposures. You can see the link right there. We'll hopefully try to put it in the chat and get more folks understanding about what their firefighter exposures are and the cancers they develop therein. Next slide, please.
Emergency room visits during wildfire smoke exposure. 4 graphs. New York State. Upper Hudson Valley Region. Eastern Lake Ontario Region. Central Region. Source: Meek et al. MMWR, 2023.
Finally, I want to highlight some of CDC's work in this area. There's 2 articles in the Morbidity and Mortality Weekly Report published in 2023, one by Kristen McCardle, who you saw the link for earlier, and one by Meek. And these both highlight the emergency room visits during the Canadian wildfire season, with a spike in the middle, irrespective of which location you were in, daily ER visits and coordinates with really strong coordination with PM 2.5.
Infographic. Emergency Department open brace ED close brace visits for asthma increased during wildfire smoke exposure in New York. Asthma-associated ED visits increased over 80% on the day with the highest exposure to wildfire smoke. Have asthma? Talk to your clinician about strategies to prevent asthma attacks.
You go to the next slide, we have our infographic, which I think was most helpful, really to pull down what is that increase. And there's an 80% increase in ED visits for asthma over that time period. So what do we do about it? Again, I want to leave time for discussion. Next slide.
Respirators. NIOSH approved N95 respirator. NIOSH approved is a certification mark registered in the United States and several international jurisdictions.
This is the current CDC recommendations, and there were a couple questions in the chat about respirator use. And there is a great website that I cited or answered in the questions and answers about respirator use. And so the current recommendation is that children greater than the age of 2 or greater than equal to the age of 2 can wear respirators. Generally, cloth and paper surgical masks are not sufficiently protective against particulate matter. And there is a question about what if you have facial hair, longstanding issue with respirators. And there is a whole section that I put a link to in the answered section of the question and answer period that talk about loose fitting respirators. I think it's still a topic that really needs a lot of work, particularly if you have facial hair. And you need to have a good fit on that mask. If you have facial hair, it's not going to work out. It's not going to fit and it's not going to function as it should. And again, fit testing is really important to make sure the respirators you're using are actually functionally cleaning your air, improving your air. With that, I'm going to stop. And there's a couple questions in the question and answer period. You can go to the next slide. I think that's the end of our presentation.
Acknowledgements. Eric Svensson, Maria Mirabelli, Ambarish Vaidyanathan, Jill Shugart, James Gooch, Brian Hubbard, Krista Hale, Richard Evoy, Amy McCrae, Brian Kennedy, Anna Kahn, Jonathan Lynch, Grace Morris, Ayanna Perkins, Yulia Carroll, Kristen McCardle, Tia Dowling.
I'm going to defer to Anna for questions and answers if you want to. I only have 2 minutes left. Sorry.
No worries. So right now, since we have limited time, let's take one question. Is there one question that the panelists would like to add to? I know we got several that have been sent in. So is there something that we want to discuss right now? Tony, with that, I'm going to hand it back over to you and your colleagues.
Thank you for joining us today. Nexus at cdc.gov. For more information, contact CDC/ATSDR. 1-800-CDC-INFO open brace 232-4636 close brace. TTY 1-888-232-6348. www.cdc.governor www.atsdr.cdc.governor. The findings and conclusions in this report are those of the authors and do not necessarily represent the official position of the Centers for Disease Control and Prevention and the Agency for Toxic Substances and Disease Registry.
I was going to maybe talk with Pete and Brett to talk a little bit about the wild and urban interface and perspectives about the wild and urban interface.
Okay, thanks, Tony. Got a live one there. Let me refer to the Wildland Urban Interface is the area between the wildlands and where more dense population is present. It can be, and we had actually a slide at one time that we pulled for the timing. Fairly densely populated to sparsely populated, but where people live. Unfortunately, in this area is the example that I showed you, the campfire in Paradise, California, which consumed a lot of homes and infrastructure. And with it, more challenging levels of air pollution and an area of increased research. The good news in this is that a lot of the wildfires we were talking about do not consume human materials, which is the good piece, and we certainly don't do that in prescribed fire. Those are only natural fuels, but it is a very specific challenge. It is one that is a challenge for the wildland firefighters and the decisions, and for the evacuation responses and the downwind communities. So this is an area also for firefighter exposure that we are looking into as well, in how to really emphasize protection of fire personnel in that space. Am I getting where you want it to go, Tony?
That's perfect. Thank you, Pete. I'm going to cede to Anna to close us out. Thank you so much.
Okay, thank you. And thank you to the panelists for adding additional links to resources. And I want to thank all of our panelists for presenting today. And the information you provided was very helpful and very useful, so thank you. And then I just want to also mention that we have our part 2 on July 18th from 2 to 3 Eastern Time, titled Wildland Fire Activities in State, Tribal, Local, and Territorial Public Health Agencies. And with that, thank you all for joining us today. Take care and have a great day.